How soon can you get pregnant again after giving birth? Believe it or not, you can get pregnant again before you even have your first postpartum period. It's technically possible to go from one pregnancy to another without having a period in between. Since it's difficult to know exactly when you'll ovulate before you start having sex again, talk to your doctor at your postpartum checkup about birth control options if you're trying to prevent pregnancy. And despite what you may have heard, it is possible to get pregnant while breastfeeding, so if you're nursing, speak to your practitioner about breastfeeding-friendly contraception. Experts recommend waiting at least 18 months between pregnancies, as this gives your body time to fully heal before getting pregnant again, which can help reduce the risk of issues such as premature birth. How to ease back into sex after having a baby. Even if you've gotten the green light from your practitioner and you're excited to get hot and heavy again, you should still take things at your own pace. To feel more comfortable easing back into sex, try the following. Set the mood. Whatever it takes to help you relax: candles, a glass of wine, if you're breastfeeding, drink it right after you've nursed, or a massage, do it. Take time to warm up. Your partner may not need as much, if any, foreplay, but don't be afraid to ask for what you need, and then some. Putting in the effort to warming you up can make the main event better for both of you, so don't be shy about vocalizing what does and doesn't feel good. Lubricate. Many new moms find lubricant to be essential when first easing back into sex after a baby. Lubricant can reduce pain and help increase pleasure. Get comfortable. Invest in postpartum sex helpers like a supportive pillow, which can alleviate pressure points and help you feel more comfortable in certain positions. Assume the position. Speaking of positions, take time to find ones that feel good. Women on top or side to side might be easiest for your first few attempts, as these positions put less pressure on tender areas and give you control over the depth of penetration if you're having penetrative sex. And go at a slow, comfortable speed. Common postpartum sex problems and solutions. Just because you feel mentally ready to start having sex again doesn't necessarily mean your body will follow suit. Chances are, a lot has changed since you last had sex. You're physically healing from your delivery, your hormones may be wreaking havoc on your libido, and your family's new addition is likely draining much of your energy. Remember that you're not alone, and many new moms struggle with these challenges after giving birth. With time, you'll bring sex back into your life after having a baby, and enjoy it too. The challenge: sex hurts after giving birth. Maybe you'd read to expect painful postpartum sex, or heard it from your fellow mom friends. Maybe you were fully prepared for the possibility that sex after baby would feel uncomfortable. But didn't your practitioner give you the all-clear? Shouldn't you be filled with pleasure, not the dread of pain, at your partner's touch? Some new moms find that the pain of postpartum sex is short-lived, and isn't anything that a little extra lubricant and some creative positioning can't take the edge off in the meantime. But for others, especially those who had a significant tear to recover from, pain can be intense and surprisingly long-lasting. If sex after baby is causing more pain than pleasure, talk to your practitioner. They might recommend taking an over-the-counter pain reliever like acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, before intercourse. If you're breastfeeding, your estrogen levels are suppressed, which can lead to vaginal dryness and affect elasticity. Applying topical estrogen cream inside the vagina can help while you're nursing. Talk to your doctor about whether you should try it. Your practitioner might also suggest scheduling an appointment for a thorough exam in case there's another reason for the pain, such as scar tissue at the site of your tear, or possibly a too tightly stitched repair. A yeast or other infection could also be to blame. You should continue strengthening your pelvic floor by keeping up a regular Kegel routine, and your practitioner may refer you to a pelvic floor therapist for additional help strengthening your pelvic floor if needed. Although it's easier said than done, try to relax before sex. Even a few minutes of meditation or a quick neck rub from your partner can help take your mind off the pain before it starts.